Today, we're going to talk about the different types of solutions used in intravenous therapy. We'll begin with isotonic solutions. An isotonic solution is a fluid that has the same concentration of solutes, such as salts and electrolytes, as the fluid inside our body's cells. This balance means there's no net movement of water into or out of the cells. In other words, the rate of water entering the cell is equal to the rate of water leaving the cell, so there's no swelling or shrinking. The cell stays stable and maintains its normal shape. Some common examples of isotonic IV fluids include 0.9% sodium chloride, normal saline, lactated Ringer's solution 5% dextrose in water, D5W, which starts off as isotonic, but once it enters the body and the glucose is used up, it behaves more like a hypotonic solution. Isotonic solutions are widely used in clinical settings for fluid replacement, especially in patients with dehydration, low blood pressure, or after surgery or trauma. Now let's move on to hypotonic solutions, another important type of fluid used in intravenous therapy. A hypotonic solution has a lower concentration of solutes, like salts and electrolytes, compared to the fluid inside our body's cells. Because of this difference, water from the hypotonic solution moves into the cells, where the concentration of solutes is higher. This causes the cells to swell and, if the fluid shift is too extreme, potentially burst or become damaged. In simple terms, hypotonic fluids act like a sponge. They pull water into the cell, helping to rehydrate cells that are dry or shrunken. Some common examples of hypotonic IV solutions include 0.45% sodium chloride, also called half-normal saline, 0.33% sodium chloride, 5% dextrose in water, D5W. After metabolism, D5W becomes hypotonic inside the body. These fluids are typically used for conditions like cellular dehydration, diabetic ketoacidosis, DKA, or in cases where cells need rehydration without extra salt. However, it's very important to be cautious. Hypotonic solutions are not recommended for patients with brain injuries or increased intracranial pressure, as the swelling can worsen their condition. Now let's discuss the third major type of IV fluid, the hypertonic solution. A hypertonic solution has a higher concentration of solutes, like salts or glucose, than the fluid inside our body's cells. Because of this, water moves out of the cells and into the bloodstream, where the solute concentration is higher. This causes the cells to shrink or shrivel as they lose water. In simple terms, hypertonic fluids act like a magnet. They draw water out of the cells and into the surrounding fluid. Some common examples of hypertonic IV solutions include 3% sodium chloride, 5% sodium chloride, dextrose 10% in water, D10W, dextrose 5% in 0.9% normal saline, D5NS, dextrose 5% in lactated Ringer's, D5LR. Hypertonic solutions are used in clinical situations like severe hyponatremia, low sodium, cerebral edema, to reduce brain swelling, fluid resuscitation in carefully monitored settings. However, these fluids must be given slowly and with caution, because they can cause fluid overload, increased blood pressure, or damage to the veins if not administered properly.